No, so earwax removal itself is a very painless procedure. If there is any discomfort, it's generally because there's either an infection or something else underlying. So approximately an earwax removal should take between 15 to 30 minutes depending on the patient. So there's 3 methods in which can be used. So you can do microsuction, irrigation or manual. For myself, I do microsuction. So microsuction is considered the safest because we're not touching anything bar the wax itself, and it's actually been given the gold star for earwax removal. Yes, absolutely. If it's considered safe to do so, we'll always strive to take both out in one session. Yes, you should do. However, the machine itself is quite loud, so you may have a temporary threshold shift for between 24 and 48 hours, but after that time you should definitely feel an improvement in your hearing. So if you're having an earwax removal done, we do ask that you use olive oil 3 to 5 days before your appointment, 2 sprays in each ear, and that's just to soften the wax tone and enable us to do a safe microsuction procedure for you. Yes, absolutely. There's no harm in it at all. We may use different techniques to ensure that we're making everything safe for you, but it's completely safe. Yes, absolutely. As long as you're not feeling any temporary dizziness, that can occur very rarely in some cases. If you do feel a little bit dizzy after the procedure, we just say just wait a few minutes and that should level off itself. It's extremely rare to feel dizzy after an earwax removal. However, if you do, it's only temporary and should go as quick as it's come on. So every patient is very different with this. So some patients I see every month, every 3 months. Other patients I see once a year just to make sure that there is no wax build-up. When you have an appointment, we'll sort out a personalised plan for yourself. So we do ask that you keep your ears dry just for 24 hours, just because it's a sensitive area and we've removed wax from there. After 24 hours, you're free to do as you please. No, not at all. So a blockage of your ear with wax is simply your migration process is either slowing down or it's an overproduction of your glands which produce oil in your ears, and it can be a combination of dry skin as well. So removing the wax itself is only going to improve the issue. Some people it happens faster than others, and that's why we ask you to book an appointment so we can create a personalised plan for yourself. So there's 2 main things I always say to my patients. 1, never use Q-tips. They're the worst thing for your ears. And secondly, use ear roll once a week, every 2 weeks. It's like a moisturiser for your ears and hopefully will keep things at bay.